According to the World Health Organization, WHO, obesity has reached epidemic proportions globally. In fact, the number of people living with obesity has doubled worldwide since 1980. Defined as excessive body fat accumulation that presents a risk to health, obesity is a complex, multifactorial disease influenced by genetic, environmental, and behavioral factors. While the condition itself can lead to significant physical and psychological distress, it is crucial to recognize that obesity is a risk factor for numerous chronic diseases, leading to increased morbidity and mortality. So understanding the diseases associated with obesity is vital for prevention, early intervention, and effective treatment. In this episode, we will discuss the diseases associated with obesity. But before we proceed, please take the time to subscribe to our channel. Your support means everything to us. 1. Cardiovascular diseases. Obesity significantly increases the risk of developing several cardiovascular diseases, which are the leading causes of death worldwide. The excess weight places additional strain on the heart and circulatory system, contributing to conditions such as hypertension, coronary heart disease, and stroke. 2. Hypertension, high blood pressure. Obesity is a primary driver of hypertension. The increased body mass requires the heart to pump more blood to supply oxygen and nutrients to tissues, leading to higher pressure on artery walls. Additionally, obesity can lead to changes in kidney function and hormonal imbalances that further contribute to elevated blood pressure. 3. Coronary heart disease, CHD. CHD occurs when the blood vessels supplying the heart become narrowed or blocked, often due to plaque buildup, atherosclerosis. Obesity promotes inflammation, insulin resistance and dyslipidemia, abnormal lipid levels, all of which accelerate the development of atherosclerosis and increase the risk of heart attacks and angina. 4. Stroke. Stroke, a condition where blood flow to the brain is interrupted, is strongly linked to obesity. High blood pressure, a common comorbidity of obesity, is the leading cause of stroke. Obesity also increases the risk of blood clots and inflammation, further contributing to stroke risk. 5. Type 2. Diabetes. Type 2 diabetes is one of the most prevalent and serious complications of obesity. Approximately 90% of individuals with type 2 diabetes are overweight or obese. Obesity, particularly abdominal obesity, leads to insulin resistance, a condition where the body's cells do not respond effectively to insulin. This forces the pancreas to produce more insulin, eventually leading to pancreatic exhaustion and elevated blood glucose levels. 6. Certain cancers. Obesity is a recognized risk factor for several types of cancer. The mechanisms linking obesity to cancer are complex and include chronic inflammation, altered hormone levels, such as estrogen, insulin, insulin-like growth factor 1, and changes in cell growth pathways. Cancers associated with obesity include, but are not limited to, those of the colon, rectum, breast, postmenopausal, endometrium, kidney, liver, gallbladder, and esophagus. 7. Liver disease, non-alcoholic fatty liver disease, NAFLD, and non-alcoholic steatohepatitis, NASH. Obesity is the leading cause of NAFLD, a condition characterized by fat accumulation in the liver. NAFLD can progress to NASH, a more severe form involving inflammation and liver cell damage, which can further lead to fibrosis, cirrhosis, and even liver failure. Insulin resistance, common in obesity, plays a central role in the development and progression of NAFLD-NASH. 8. Sleep apnea. Obstructive sleep apnea, OSA, is a common breathing disorder strongly associated with obesity. Excess fat deposits around the neck and throat can narrow the airway, leading to repeated interruptions in breathing during sleep. This can result in fragmented sleep, daytime fatigue, and increased risk of cardiovascular problems. 9. Osteoarthritis. Obesity is a major risk factor for osteoarthritis, particularly in weight-bearing joints like the knees, hips, and ankles. The increased mechanical stress on these joints due to excess body weight accelerates cartilage degradation. Additionally, obesity-related inflammation contributes to the development and progression of osteoarthritis. 10. Gallstones. Obesity increases the risk of developing gallstones, which are hardened deposits of digestive fluid that can form in the gallbladder. Individuals with obesity often have higher levels of cholesterol in their bile, which can lead to the formation of cholesterol gallstones. Rapid weight loss can also increase the risk of gallstone formation. 11. Mental health conditions. Obesity can have a significant impact on mental health. Individuals with obesity are at a higher risk of experiencing depression, anxiety, and low self-esteem. Societal stigma, body image issues, and the chronic nature of obesity can contribute to psychological distress. Conversely, mental health conditions can also influence eating behaviors and weight management. 12. Reproductive issues. Obesity can lead to various reproductive problems in both men and women. In women, obesity is associated with irregular menstrual cycles, infertility, polycystic ovary syndrome, PCOS, and complications during pregnancy, such as gestational diabetes, preeclampsia, and an increased risk of C-sections. In men, obesity can lead to reduced testosterone levels and impaired sperm quality. 13. Metabolic syndrome. Metabolic syndrome is a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Obesity, particularly central obesity, is a key component and driver of metabolic syndrome. Thank you for watching. We hope this video was informative. Please don't forget to like and share for more health-related content. Subscribe to the channel and activate the bell. You will receive everything new.